shoulder, mid, chin. It's not easy to get such a long-lasting result. Okay? So, complications. Not so many irreversible complications. Dimple can be, you have to notice, dimple can be, but massage can improve such dimples without adverse difficulty. Massage by her or by himself, it doesn't matter. And swallowing, except that there is no irreversible complications. Oh, and let's take it to the period thread by degradation. Almost 3 to 4 months after the insertion, it can be solved by the hydrolysis mechanism. Mostly 6 to 8 months. It's biodegradable because of termination of proliferative phase, which results in the moderate amount of collagen accumulation. However, such collagen should be softened with time, around 1 year. But how we could get such a lasting result? The structurally reinforcement is wet collagen deposition accumulation along the weak side. So, such abundant collagen can.
Dr. Park, this is a gentle time reminder. There are 5 minutes left. Thank you.
Okay. Yeah. So, means another almost 3 to 6 months till complete biodegradation accumulate. Let's go. Okay. Okay, go. Go. And another interesting item is literally using rhinoplasty, making another tripod or positive part. Okay, go. Short nose, okay. Flat nose, go. Go. Up nose, or go. Saddle nose, go. Retracted columella. Anyway, today I will show you the go. The procedure can be done under local anesthesia. Pulling into the desired position. Okay, desired targeted position. Okay, well, today, because of the limitation of time, I cannot show you all the products, but some of them are very innovative. Go. The company produces the unique products. From my viewpoint, the on-dye PDO, okay, go. And various kinds of product lineup, go. And various products. I already explained, okay, go. Okay, go. And the company history is over 40 years ago and died. And the fantastic effect means the cancer strength is superior to the others. You should keep in mind, really superior. Go. It doesn't use the thermal bonding. The thermal bonding can result in the easy biodegradation, easy collapse of the threads. Okay, go. And undyed, okay, go. And much collagen deposition along the threads, go. Like it, prominent collagen network. Okay, go. And now it's time for before and after, go. And scar can be improved. As I showed you, such PDO can induce anti-inflammatory reaction, which results in the collagen accumulation. Go. Yeah, okay, go. And there are various kinds of cannulas or needles. For doctors, it's pretty much easy, yeah, to select or whichever it may be. You know? These are not cutting, yeah. These are by working without thermal manufacturing. Okay, go. 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 Okay, go. And these structures can be cell infiltration, which results in another bioscaffold formation. Such bioscaffold can have a big role in enforcement of underlying weak structure. Now, okay, go. The neck resonation, and mid-face and lower face resonation. I'll show you today. And neck resonation. Sometimes the drugs can be used for mid-face or lower face resonation. Okay, go. And using the moment curved thread, we can improve neck frontal skins. Okay, go. And forehead. Different to the conventional lateral vectors, I prefer the medial vectors. By doing so, I could get a long-lasting brow lift. Okay, go. Okay, this is the unicorn. Yeah, unicorn is used for laser tip projection accompanied by laser ridge. Go. Go. Now, the last slide. This is by a company, but I think if I would summarize, it can be accompanied by other skin boosters and lasers. And the training sessions are not so much difficult. If you see once in a time, you can redo it. You can practice it very easily. And as I already emphasized, duration of effect or protocols, and this is different to the PCL and PLMA. Some companies emphasize PCL can be biodegradable in 5 years. Right, it's right. But because of the elasticity or because of the hardness of such materials, we cannot guarantee the clinical long-lasting result. Overlap structures can be poor. If we use the PCL or PLMA. Okay, this is my paper. And if you have a question anytime, welcome. Thank you very much for your attention.
Oke, hadirin berikan tepuk tangan yang meriah untuk Dr. Park. Thank you for the. Okay, thank you for the great presentation, Dr. Park. Now we will continue with the highlight of today's event, the live demonstration of face contouring with the Ultra. To Dr. Park and Dr. Denny, the time is yours.
Okay. Before directly using face lift, the design is first. Design is pretty much important. Yeah. For the beginners, how can you lift up this patient? this patient face. We have to put some little mark by marking her. Okay? She has before having marking, we have to differentiate the drooping status, jowling. How old is she? How old are you? 40, almost 50, yeah? Late 40s. Yeah? A very good candidate. Very good candidate. Okay? Showers. Oh, it doesn't work. Okay. Okay. Let's use that. Okay. Can you see? Not prominent? Much better, right? Do you think so? Much better. Okay. Okay. This is all barrier yeah? That's by drooping of jaw or prominent jaw. Okay. Then another one. This one. India band. India band. Can you imagine the image of American Indians like woo? Understand? Okay. And grab the zygomatic arch and bone. It's pretty much easy. It's pretty much easy. It's not difficult. Like this one. Huh? That's all. We want to lift up like this way. Like this way. And the whole angle. Marking like this way.
Bisa sih di sini, cuma masih bisa datang sebetulnya.
Every patient wants to lift up like this way. This way. Like this way. So from here means between Is it okay? Yeah. Okay. Now let's go. Okay. Every patient wants to lift up like this way. Okay. Make a entry point. Make a inlet. Yeah. Between the transitional zone of forehead, like this one. Maybe 1 centimeter above the lateral canthus, there is inferior temporal septum. This is superior temporal septum. Among them, the middle. Yeah, okay. among that, in the middle of between two important structures, we can make an entry point, and this one should be target the melanocyte like this way, and another one for mouth corner, and the other one is from here to the not the longer lateral hollow area. Escape the lateral hollow area. That's all. And from here, and from here. 3. And then, before the operation, I showed you the suspension bridge. Yeah? This can be the anchoring point. Yeah? Anchor the curing point, like this way. And then lift up another one from here. Means, like this way. From medial to the masseter muscle. Lift up like this way. Another one. And the other one, similar, just below the zygomaticocutaneous ligament. Here, lift up. Yeah. From now, I will show you. Okay. Make an entry point. Here, section, user, 1, and okay. Wait. Here. Okay. Like this way, and this way. This is masseter. Medial to the masseter, and another one, lift up. Okay.
Dr. Park, I will translate a little bit. Jadi nanti teman-teman dokter semua, Dr. Park akan melakukan 5 benang satu sisi wajah, 3 dari atas ke bawah seperti yang tadi dari atas. From the first entry point, you're going to use 2, and 1 for the lower part. Jadi 2 dari atas, 1 untuk yang area bawah. Setelah itu dia akan melakukan yang dari bawah ke atas untuk anchornya.
Okay. And in case of nose job, just insert the thread by pulling down. In case of short nose, not the middle, beside the middle, which means for the prevention of extrusion of thread. Okay. Here. Now it's time to inject the locals. Okay. Already diluted? Oh, excellent. Oh, very excellent. Are you a doctor? Is it hygienic solution? Okay. In case of fluid lifting, it doesn't produce the complication like severe infection or severe inflammation. Okay? Close your eyes. It's okay for showing. Yeah. for the demonstration. Yeah. Usually in my clinic, I prepare the lay down position, like supine position. But this is time for education, yeah, for demonstration. You can see easily, yeah, on almost upright position, right? Okay. Now it's okay. Oops. Yeah. Oh yeah. Right. Okay, look at the leader, yeah? Almost same, but longer, only longer, yeah? 26 gauge, but longer leader, yeah? Doesn't matter, okay? So, at the beginning, we should, usually patients are too much fear of the injection or pain. So make a gentle massage like this one. And my preference is my preferred entry is around the beginning of Indian bend, like this way. And, okay, like this action, yeah, okay, do not hesitate, inject as much local solution as possible. Sometimes it can block the inferior nerves, so patient cannot feel much pain. And another one, okay, like this way. Let's go, if she feels much pain, let's go. A little bit, huh? Like this way. Okay. Okay. Another one. Okay. As much as possible. Good feeling. Maybe in each side, my preference is the 15 cc. At least 15 cc. 20 cc, it's okay. 20 cc, it's okay. After that, no worry about it. No worry about it. Okay. Like this way. And inject as much as possible. Okay. Sometimes I make a medial squeeze like this way, using another inlet cord lateral to the nasal bone. Today, in front of these big audiences, these big guests, I'm sure maybe you have not experienced them. You have not seen medial squeeze so far. Make as much as possible. Okay. Now can you see? Okay. The first entry is the beginning of the Indian band, like you say. A little bit? Okay. Okay. No, I can't understand. It's because of the description of performance.
cairan yang digunakan untuk anestesinya adalah PHK sama NaCl 1:1 ya. Dan Dr. Park ini tipenya maunya banyak, jadi bisa 10 sampai 15 cc satu muka. Terus di ini, dan jarumnya khusus dari dia bawa sendiri, jadi mungkin panjang tapi tipis gitu.
The reason why I inject local solution from separated to holder is think about immediately if you receive local on the nasal on the nasal tip, because of the dense structure, it can produce much pain. Yeah? So usually from soft to dense.
Yeah.
This is usual principle. And then make it, I know. Yeah. Okay, another one. Okay. I emphasize, do not hesitate injection of locals as much as possible. Do not hesitate. Yeah? Do not hesitate. I know. Okay. Now, wait another 5 minutes. Okay. And then, now let's start. Okay. Now let's start. Now let's start. The first one, like this way. Okay. Hold press. And taking these meters. Excellent. Lift up the mid-face, okay? It's not difficult, yeah? Punch it using the little gaze. No bleeding. No bleeding. That's important. If you escape from the transition zone, there's much possibility of bleeding. It doesn't produce much bleeding. This is a white period. You have never seen it. Okay? Like this way. Okay. Like this way. And then you remove the tail. And push it, and feel the cannula here, and then remove the cannula, and then like this way. Can you catch it?
Yang kita gunakan yang ada stoppernya tadi ya.
Okay. Do you have scissors? Yeah, very secret. Okay. Can you catch it? Okay. Let's go. Like this way. Maybe you accomplished it. Yeah? Improve the leadership. Okay? And another test. Now, another one. To the mouth corner. Like this way. Feel the mouth corner. The other one, okay? Above the inferior temporal septum, along the hairline. Along the hairline. Okay. Bending like this way, avoid the natural hollow area. Okay, yeah, okay, I know. Like this way. Okay. There is some irregularity. Okay, don't worry about it. Making massage. Just making massage. It goes really with time. Okay. Okay. For the pair numbers, I want to insert another one. Okay. Like this way. Here. Like this way. Here. I was supposed to insert only 3 threads, but this time, more than 4, 3, okay? Close. You can see improvement, okay? We need to some more, okay? Take it easy. As I'm showing you,
jadi sekarang baru yang dari bawah ke atas ya untuk anchornya. Tentu saja stylenya bisa masing-masing ya. Kalau kita mungkin lebih pelan. Ya, tapi resultnya memang sekuat itu. Tadi menggunakan tadinya mau 3 benang jadi 4 benang. Dan anchornya 2.
From your viewpoint, it looks too much. It looks, but make it massage like this. That's all. That's all. What?
Ya, jadi kelihatan hasilnya ini dengan 6 benang, 4 ke bawah, 2 ke atas dengan polanya masing-masing ya tadi. Cuma perbedaannya sama yang kita lakukan adalah mungkin kita anestesinya biasanya nggak sebanyak itu ya.
From a home viewpoint, or it's pretty much oriented. Yeah. Look here, from here.
Ya, kalau bisa dilihat sebenarnya dari atas itu kelihatan bedanya, yang satu pipinya jadi lebih naik gitu ya, kelihatan liftingnya.
This is basic, basic, and then insert.
Boleh kamera?
Look at the camera. Difference? Okay. Position.
Ya.
Right and left side, the design position is totally different.
Ya, liftingnya memang terlihat bagus sekali, tapi juga ini masih banyak cairan anestesinya, jadi kelihatan gemuk sekali. Tenang aja, kita pemain benang pasti tahu nanti juga akan turun ya, akan lebih turun sedikit, lebih tetap lifting tapi lebih kecil slim wajahnya, nggak akan takut jadi gede kok. Oke.
Okay, now I want to make her, on the opposite side. Okay. Prepare the thrust. It's very excellent. Maybe I think you already experienced many things. If you feel the resistance because of the ligament, make it steady. It doesn't influence on the underlying damage, because we already inject enough amount of blood solutions, like this way. Okay. That's too much from your viewpoint. However, they can massage. Okay. Like this way. Across the meridian line, we can lift up the underline, the platysmal or some smas, like this way. Okay? Just too much. But making massage. Before termination of operation, making massage. And here, It's okay. We made another wrinkle gems on the temple, and there can be some resistance. Oh, too much. Okay. Too much gems. The last one. The last one. Like this way. Or superficially. There's a symmetry, but make a massage. Make a massage. Make a symmetry. And then I will show you the last step. Okay? 18 days. Okay? As I promised you, little squeezing. Maybe this is first time. Okay? important structures like this one. Have you ever seen? No, this is the original. Like this way. What is that? Sometimes too. But maybe you are afraid of this procedure of meat. Yeah? Yeah. This is for educational purpose. Yeah? Yeah. Okay. Cross the facet muscle insertion. Yeah. This way. Maybe now you can use it. Why I do this procedure? Yeah. To prevent relapse into the original position. Make it this technique can produce the long-lasting result.
Ya, jadi salah satu kunci dari Dr. Park bilang hasilnya tidak akan long lasting adalah teknik yang tadi, karena katanya itu akan kayak menjaga supaya nggak turun lagi gitu. Ya, bisa dicoba ya, tapi harus agak hati-hati.
Now let's go to the notes.
Oke, sekarang kita lanjut ke hidung. Dokter kalau ada pertanyaan boleh, ini lebih interaktif. Langsung nanya aja, saya coba sampaikan.
Okay. 80 days later. Whenever do the nose procedures, always open your mouth, breath through your mouth. Okay. Okay. And do not puncture. Do not make entry point in the middle or about 2 millimeter beside. Okay. There is a chance of bleeding, but stitching prevents such bleeding. This is for nose bridge. Okay, like this way. Okay, 4 pieces. Okay, like this way.
Salah satu yang aneh adalah
Cause please, cause.
Oke, jadi salah satu yang aneh dia bilang buka jalannya jangan tengah banyak bleeding, sedikit beberapa mili ke samping. Ya, 1-2 mili ke samping, ya kita bisa kasih jalan, tapi nanti arahnya tetap lurus, bikin lurus nih masukinnya.
She has a low profile and short nose. Okay. And pull up your desired target position. Yeah, like this way. Like this way. 3 and 4. Okay. Okay. Look at her little bridge. Little ridge. Can you see? Okay. Can you see? That's the problem? Okay. And the short ones. Okay. Short ones for making another tripod, like this way. Pull up, and leave it, and pull up to the desired direction, desired position, I already injected enough amount of vaccination, okay? And then another two. Another. Okay? And then we have to insert this thread into columella, like a pull-up. Okay, that's all. Okay, make sure the thread is inserted properly, like that. 2 pieces enough. Okay. Can you see the difference? Okay. Oh yeah, there is. Okay. Scissors. Okay. Scissors. Okay. Another one, please. Another one. Okay. I'll show you. If it is not properly positioned, yeah, remove or cut. Okay. Yeah, like it. Make sure. You should make sure. Yeah? This time, for to make sure, I want to use this cannula, like this way. Okay. Maybe. Okay. Oh, very. Do you have forceps? Okay, forceps. Okay. Oh yeah, good.
Ya, kalau ada benang yang keluar, cabut aja.
Not properly positioned. So remove or cut. Remove. Okay. Sometimes cut, sometimes remove. That depending on doctor's. No, it's okay. Yeah, no need. And small amount of filler. You can see the hip projection. Okay.
Ya, jadi juga akan dikombinasikan dengan filler keras untuk area hidung.
Very small amount. Why are exact fillers? It's for the prevention of the irregularity, not for the augmentation of mouth, not for the value. Can you let? Yes. Very small amount. This is 1 cc. So 1.5 or a small amount for the prevention of irregularity.
Mengundang banyak pertanyaan, silakan bertanya.
Half is enough.
Setengah cc ya.
Okay.
Kanulanya 23, pakai cara keras.
Okay. Now, okay. Make a massage, yeah, for the prevention of irregularities and dimples. Okay. Do you have mesh? It's okay. Okay. Next time, the company didn't prepare the mesh. Yeah, mesh it can be used for augmentation of nasal lateral fold and for the further augmentation. Okay. So instead of fillers, I prefer the mesh thread insertion. So the remaining one, yeah, you can.
Biasanya dia tetap menggunakan benang mesh untuk nambahin volume. Cuma
18 days.
sisa.
18 days.
Cuma kan ada sisa fillernya aja dia tambahkan ke situ ya.
No bleeding. Okay. because everything was okay. Basically, the process was finished. Okay, and now the last thing, the dressing. Yeah? The dressing. I prepared
Ini salah satu yang penting, dressingnya. Nah, ini kita belajarnya dari Korea nih, kalau dressing
like this way. Like this way. Okay, scissors. Okay, scissors.
Di kita jarang ya pakai gini-ginian, tapi bisa jadi insight baru. So what's the reason for this taping?
How many days or how many hours? At least 8 hours. But
5 hours.
my recommendation is about a day. At least a day.
At least a day.
Yeah.
And the reason why we should do this?
Simply, yeah. If she make a vigorous movement like mouth opening or something like that, there can be much chance of relapse. So for the prevention of relapse, you can think of the concrete molding. Yeah? Or there is a big construction in case.
Dan tujuan juga supaya pasiennya nggak kena berlebihan.
Split molding.
Kalau buat saya sih kayak keren habis operasi aja sih. Canda ya.
This system is wonderful. Okay. Okay.
Dokter Linda, kita tidak ada waktu lagi ya. Habis ini saya Q&A ya. Ya, karena waktunya kita cuma bisa sampai jam 12, which is tinggal berapa menit lagi? 5.
Done.
So because we only have 5 more minutes, we will have the Q&A session now.
Okay.
Dok, silakan tanyain semuanya.
Some questions
Yeah.
from the floor?
Presence. Kayaknya ada hadiah kali dari Anaya ya? Tuh, ya oke dokter silakan.
I have many questions actually. The first one is about the entry point.
Okay.
Because I saw that you started the anesthesia from the entry point and all around the entry point. Is it possible for us to add more anesthesia? Maybe only
Of
a
course.
Because I saw the patient is quite painful when you do when you make the entry point there. It's quite painful there.
Yeah.
And the second one about the things that you did, like making a new line.
Needle feeding.
Yeah. Is it common there? Because I never saw that kind of procedure.
Not only Dr. Park.
And is it any risk?
No risk. If you
Have you ever did it many
I've
times?
never. Yeah.
Oh, but no risk.
There is no risk
And it's
because you may think my local injection. Yeah? I emphasize it. Enough local injection must be. Yeah? In my clinic, mostly 20 cc, and wait another 10 minutes. After that, hydrodization can enable the doctors to insert the position properly along the dissected layers. So, no risk.
One more. After you did the first at the right side, I saw the under eye is quite a little bit cekung gitu ya dok.
Okay. So there's hollow.
Yeah, it's a hollow under the eye.
It's a pretty much usable. Although I look up as much, it goes down with time. For letting the patient have the biggest satisfaction, the target time is not 1 month, usually 4 months. Before the operation, you should notice that our target time is 3 months. So such hollowness goes away with time.
Yeah, my question is this: can we do another procedure like give a thread to volumize the hollowness there. If we can do that, is it possible to do it at the same time, or we need to wait?
Same time.
Oh, okay.
Using the mono thread or skin boosters like PLLA. Not PDLLA. PDLLA can produce some nodules. Nowadays, pretty much common in Korea.
Baik, saya resume ya dok ya, karena satu, yang perlu kita tekankan adalah pengerjaan ini dilakukan oleh seorang plastic surgeon di mana biasanya dia pasiennya pingsan. Ya, tentu di kita jarang yang seperti itu kecuali kita punya bedah plastik dan anestesiologis di tempat kita. Jadi kalau kerjanya terlihat cepat, terus anestesinya banyak sekali gitu ya, itu terkebiasaan mereka. Tapi tekniknya bisa kita pelajari bahwa taruh dari tempat yang tepat, sedikit dibengkokin tapi kita pakai sarung tangan steril mungkin akan menjadi tips-tips bagus untuk kita. Terus dari bawah ke atas juga bisa untuk sebagai anchor, dan dari sini ke sini bukan tidak ada resiko. Kalau bilang gampang dia ngomong ada resiko, ada. Tapi dengan anestesi dia banyak kan udah ada ruang tuh, jadi kita chance-nya untuk kedalaman jadi lebih kecil gitu. Tentu saja kita harus lapisan yang tepat, lapisan dalam intraorbital. Boom, hematom segede luar biasa kalau kita salah gitu ya. Jadi tetap ada hati-hatinya, tapi karena dia banyak cairannya, jadi dia tuh lebih mudah untuk masuk kanalnya. Dan dia harus, lapisannya harus tepat untuk exit. Tapi ini juga menurut saya sesuatu yang boleh kita kerjakan. Kalau kita udah tahu lapisan yang benar, kayaknya bantu memang. Secara konsep oke gitu. Untuk ini semua ke sana, terus ditambah satu ke sini, kayaknya konsep yang bagus untuk menopang ya, supaya tidak jatuh lagi gitu. Terus soal bawah mata, kalau buat saya itu adalah hasil sementara benang membuat dia cepu. Dengan berjalannya waktu dia akan turun, lebih baik nunggu sampai turun. Kalau memang hasil benangnya sudah benar-benar bagus, sudah jadi, memang ada kosongnya, baru kita lakukan sesuatu. Kalau nggak sih, over dokter mengerjakan semuanya, tapi dalam kondisi lagi bengkak gitu. Kan aneh, kan belum tentu itu hasil benernya gitu. Gitu sih. Oke, kayaknya waktunya habis ya, Dr. Linda. So Dr. Park, thank you so much. That's an insightful material. We don't have time. Okay.
Oh my God.
Dokter, terima kasih semuanya. Saya kembalikan ke MC Dr. Linda.
Okay, big applause for Dr. Park and Dr. Denny. Oke, kita sekarang masuk acara door prize ya. Ada 3 door prize senilai masing-masing 5 juta rupiah. Ya, silakan Ibu Devi untuk memandu seksi door prize. Silakan. Bu Raquel, silakan. Di dalam tas dokter itu ada nomor dok, ada nomor ya, dilihat. Silakan Bu Devi untuk mengambil langsung ya, langsung 3 ya, langsung 3 gulungan, langsung 3 gulungan. Di tas di samping.
It's my pleasure.
Ya, kita buka ya dok. Nomor 52.
52. Nomor 52. Silakan.
Take picture.
Kemudian selanjutnya
We're gonna have a photo shoot session after the service.
nomor 68. 68. Silakan.
Paling depan.
Yang terakhir nomor 46. 46. Silakan dok. Coba dibuka-buka tasnya dulu. Oh ya. Mohon kesediaan dari Prof sama Dr. Denny.
potongan belanja 3 juta, jadi kita undi lagi ya dok ya.
Tunggu ya dok, 5 nomor ya dok. Nomor 73.
Nomor 73.
Oh ini.
Nomor 73.
Nomor 66.
66. Silakan dok, barangkali ada mau dicek.
Nomor 66.
Lanjut, nggak ada kayaknya ya.
Ya. Nomor 48.
48.
48. Kalau nggak ada kita ganti ya.
Iya, ganti.
Nomor 10.
10.
Nomor 18.
18.
Selanjutnya nomor 55.
55. Silakan dok.
55.
Lanjut, nggak ada ya.
Nomor 14.
14.
14. Ya.
Lanjut.
Nomor 17.
17. Lanjut.
Nomor 29.
29, Dokter Rika, silakan.
Satu lagi ya. Nomor 40.
40.
Oke dok, berakhir sesi door prize kita ya dok. Terima kasih udah hadir di live demo PT Anaya. Mudah-mudahan tekniknya bisa terpakai di klinik-klinik dokter.
Dok, ini masih ada kita, kalau ada dokter yang mau diwawancara sama dokter Parknya dan dokter Denny, kita ada 2 orang. Silakan maju ke depan kalau dia mau. Kita kasih ada oleh-oleh dari Anaya, benang 1 pouch. Silakan maju dok, 2 orang kalau dia mau. Ya kira-kira. Ada yang mau silakan dok. Ya bertanya sekalian di interview sama dokter Parknya dok.
Oke, untuk selanjutnya apresiasi kepada Profesor Park dan Dr. Denny, kepada Bapak Jesse dan Pak Handri, silakan untuk memberikan plakat kenang-kenangan. Kepada Bapak Handri, Pak Jesse, harap ke depan untuk memberikan kenang-kenangan kepada Dr. Park dan Dr. Denny. Dr. Denny, silakan. Ya, silakan kepada Pak Jesse untuk memberikan kenang-kenangan kepada Dr. Denny. Pak Jesse, silakan. Pak Jesse, silakan. Pak Jesse, silakan untuk memberikan kenang-kenangan kepada Dr. Denny. Ya, Pak Rangga, tolong diberikan. Ya. Terima kasih, Dr. Denny. Plakatnya. Ya, plakatnya silakan Dokter Denny silakan diterima. Enggak, Dokter Denny dulu. Oh, Dokter Denny. Terima kasih Dokter Denny. Ya, tepuk tangan buat Dokter Denny. Oke, selanjutnya kami minta kesediaan Bapak Handri untuk memberikan kenang-kenangan kepada Profesor Jin Park. Terima kasih Dr. Park. Tepuk tangan sekali lagi untuk Dr. Park. Oke, kita masuk acara terakhir, foto bersama. Silakan Pak Handri, semua tim Anaya silakan mau foto. Silakan dokter kalau mau foto. Tim Anaya. Oh, ya, silakan di foto session. Silakan foto session. Oke, tim Anaya silakan mau berfoto dengan Prof Bu Devi. Tim Anaya, silakan tim Anaya yang mau berfoto bersama. Ya, semua, ayo foto semua, ayo semua. Silakan yang mau foto dengan Dr. Park dan Dr. Denny, silakan. Silakan. Silakan, ayo teman-teman dari PT Anaya gabung. Atau kalau kebanyakan bagi dua dulu ya, bagi dua dulu. Ya, sama peserta dulu. Ya. Oh ya, oke. Ya, silakan para hadirin yang ingin berfoto dengan Dr. Park, Dr. Denny, silakan.